right. Welcome to Early Care Connection. I'm Izzy Greenberg. Today we are joined by our usual panel of experts, Meryl Gay from the Connecticut Early Childhood Alliance and Ava Bermudez-Zimmerman from the Child Care for Connecticut's Future campaign. We also have a terrific lineup of special guests who are going to give us a recap of the 2024 Connecticut legislative session, which just finished up on May 8th. There's a lot that's happened even in this short session. And so there's plenty to go over this morning. Just a reminder to everyone that speak slowly for Spanish interpretation, even if you're asking a question, if we can call on you. And also, thank you to Sandra for providing interpretation. Just a reminder to folks that you can use the chat for questions for the community. Excuse me, questions for each, oh my goodness. Reminder that you can use the chat to have conversation with the community, with each other, or to let us know if there's any technical difficulties, but please use the Q&A if you have any questions for our panelists. We are going to kind of break this up into some chunks. So I'm not going to ask questions after each guest. We're going to kind of go through this, and I'll just lead us through the way that this is going to go. So everybody just sort of sit back and pay attention. We are going to get started with Representative Michelle Cook, who is the person who hosts the Connecticut Early Childhood Caucus, is an incredible champion of early childhood and children's issues. And we want to get started with her. If you could unmute yourself, Representative Cook, we'd love to turn it over to you.
Thank you. And I've pulled over. So I apologize for my location. I am volunteering at a golf tournament for my food bank today. So I'm on my way there now, but I was honored to be asked to join you all this morning. And am I speaking slow enough?
Yes, you're doing great. Thank you.
Perfect. First, I want to thank everybody for all of the great advocacy that they have done this legislative session. Although we recognize that anybody that has been in our building for years have recognized that this is a very weird legislative session. We were successful in getting, some things done, not everything, obviously, that we wanted done. As Meryl knows, we want $750 million. We keep asking, but we haven't received that as of yet. But this legislative session, we were instrumental in advocating for some incredible policy changes, some pushing back on some policy changes, and I think some that note that you will hear about later that you all were instrumental in helping with is the certification pushback. We were able to get a one-time wage supplement of $1,800 for certified educators in the classroom, with the caveat that you have to register with the Office of Early Childhood on the registry. That is a two-folded conversation. We wanted to recognize the great work that everybody's doing, but we also wanted to understand how many educators that we have out there so we know what we need and where our shortages are. So working with the Office of Early Childhood, it's been extremely successful moving forward in that regard. Also wanted to just say a little bit about the overview of 5002. I know Representative Farrar is supposed to be on here in a little bit, but so she will talk about the larger component about what you all originally knew as the Early Childhood Trust. And then we were successful in a variety of other different things. And Maggie Adair, who has really held a lot of us together over the last many, many years, will be able to give you updates on that. And I want to thank Meryl for being kind of the eyes and the ears where we couldn't be everywhere. This year, we took a lot of proposed pieces of legislation and condensed them into larger bills. That was easier for the chairs to do that. And with our limited amount of session days, that doesn't mean that we lost a lot of things. It just means that if you were following our legislation, things kind of got condensed into other things, which you will hear Meryl and Maggie and Kate talk about as we move forward. So please, 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 as we leave this legislative session behind us and implement the things that we instituted this year. Don't stop advocating for support. My role as the early childhood caucus chair, that is one of the most important pieces of things that you can do from now until next January, because bringing everybody to the table every week during the early childhood caucus has really helped us make good, effective policy changes. So please don't feel that your voices aren't heard. They are absolutely heard. And I think as this conversation moves along, you will hear that in the many pieces of legislation that were successfully pushed over the finish line.
Great. Thank you so much, Representative Cook. You're a little bit choppy. So is there more that you wanted to go over? I just want to make sure before we move on.
No, I know that I'm in a weird spot, and I just wanted to give everybody the opportunity to give the details, and I just wanted to give the overview. I'm sorry for
Great.
that.
No, that's okay.
I was priorly committed before Meryl asked me to talk.
Oh, it's great. We're happy you're doing it, and we're happy that you were able to be here with us this morning. So thank you so much. Have a great day. I hope the weather is beautiful for you.
Thank you.
Great.
Thank you so much. Thank you.
Okay, and just to remind folks, we are doing a legislative recap. This is on Facebook Live, and so I want to just re-announce that we are doing a legislative recap from the 2024 session today. We have a number of guests on this morning to speak about that. So we are actually going to go next to Maggie Adair. Maggie, are you able to join us now?
I am.
All right, fantastic.
How are you?
Great, welcome. Maggie is from the Office of Early Childhood, and she is going to go over a number of early childhood bills. Maggie, I believe Representative Farrar will join us at 10 to speak on 5002, but you're certainly welcome to touch on that from the Office of Early Childhood perspective. Thank you so much for joining us.
Thank you, Izzy, and thank you for inviting me. Can you pull up the PowerPoint? I'm going to cover actually just two bills that were very important. One of them is the governor's bill establishing Early Start Connecticut, and the other one is our agency bill, which was in Senate Bill 152. So the governor's bill originally was 5051. It was, as Michelle Cook rightly said, it was a short session, so it was rolled into a larger education bill, Senate Bill 14. It's covered in sections 24 through 38. And this is establishing a single state-funded early care and education program called Early Start Connecticut. This is what the office has been striving to do for a very long time. It combines three important state-funded streams, which is child daycare, school readiness, and state Head Start supplement. What does this accomplish? It streamlines the system. It reduces burden on providers. It simplifies things for families, and it's focused on center and community needs. I want to stress that this does not go into effect until FY26, which is July 1st, 2025, a year from now. This gives us a year to implement and plan the system and working with the community, our state-funded community, to make sure we get this right. We will be listening to them all through the year. Next slide, please. So here, how does it streamline the system? It's going to simplify our staff requirements. It's going to create clear accreditation standards, which are already in effect. National Association for the Education of Young Children, National Association for Family Child Care, and Early Head Start or Head Start approval. It will standardize the fee scale for families. We will maintain the designated state Head Start funds. Those are $5 million in funds that will be separate and be funded. Next slide, please. Also, we're going to allow for flexible payment units. We're going to be paying providers upfront and quarterly and paying by classroom. This is going to create better stability for the providers. We will streamline contracts. We're now going to directly contract with the providers or a third-party intermediary to manage the contracts. School readiness is currently a grant program. The child daycare is a contract. We really want to streamline the system. We will adhere to funding applications for our chief funded programs to create stability. We will be prioritizing existing state-funded programs in the RFP process that will be later in a few phases. And we will consolidate application and fund reporting requirements. Currently, programs have both child daycare and school readiness. There's multiple different funding and reporting requirements. This will reduce the burden on providers. Next slide. It's also going to expand access. We are eliminating the family work requirements previously included in our child daycare program. We are at least 60% of children participating will be members of families at below 75% of the state median income. This is not new. This is just continuing what we already have in place. And then we are creating local governance partners, which will be very similar to the existing school readiness councils, but with a different role that I think will be more exciting for the communities and the liaisons. So this will be doing a local needs assessment with the local governance partners, with input from the partners in the communities, so that we can really know where we need to be funding the slots. Next slide. What else is in SB 14? So the Early Start Connecticut, it's a big step, and it's a system step, and it's really creating a better system moving forward for our state-funded programs. But there are other elements in SB 14. This is the incubator model. I know Corliss is going to be talking about that later on, so I won't go into great detail, but it just is, we're going to allow it to go statewide, removing the sunset date. We're going to cap the number of facilities currently, for right now, to 20. And more than one facility can be located in a community. We work very closely with the Connecticut Project. They came to us with this proposal, and we worked together to make this happen, which is great. One thing that really applies to all programs, not just state-funded programs, is licensing ratios. We will be implementing policies and procedures to change the licensing ratios for rates for toddlers over 2 years old will increase from 1 to 4 to 1 to 5. And school age ratios are going to increase from 1 to 10 to 1 to 15. We anticipate that this will be in place no later than the end of August. We're going to be able to allocate funds to the rest for the technical assistance, professional development, and evaluation program planning. That's a really good change. And then Smart Start, we just removed a cap because there's current programs in the Smart Start for Recovery who have more than 300,000 per community. That was a technical change. Okay, so that's what was in SB 14. I'm now going to just turn quite quickly to 5002. Representative Kate Farrar is going to be covering this bill. I'm just covering the section where our agency bill, which was Senate Bill 152, got folded into the larger bill. And I want to highlight just a couple of the bullets. The first one is technical about posting developmental milestones. The second one's really important. It's actually allowing us to follow and adhere to federal CCDF regulations. Those are the Federal Care for Kids program, the regulations. They change frequently. Our current regulations are outdated and obsolete, and take a long, long time to change. In fact, some of our regulations conflict with the federal rules. So we're going to be able to adhere to those and repeal the current Care for Kids regulations and start anew so that we can build a better program that makes more sense. Another Care for Kids important piece was we add subsidized guardianship to the protective services category for Care for Kids. We unintentionally, in just legislation passed last year, did not include this group, so it was leaving a few families out. And then lastly, on our agency bill, it's requiring licensed childcare settings to allow birth-to-three providers to provide services on site. There was also a couple of technical changes. The last bullet I want to call attention to. The OEC is going to develop a document explaining the benefits of liability insurance that we will distribute to all programs. There was another section in the original bill that was going to require programs to notify parents whether or not they had liability insurance. And legislators decided that they didn't want that part of the bill in there, nor did we. And it was not included in House Bill 5002. So those are the sections that I am covering for today.
All right. Thank you, Maggie. There's two questions here that we're going to get to. Since DCF payments are supposed to go under Care for Kids, will it stay in this new grouping?
Yes.
Yes, that's easy. Someone else joined a little late and they want to know if either of these things being implemented are for family child care as well.
Yes, because our all of those, like the ratios would not apply to family child care, but many of the other things would apply. They are part of a state-funded program because there are some family child care providers who took on the infant and toddler in our system. So that is one place where it'll affect them.
Okay. All right. Fantastic. Thank you so much, Maggie. Meryl, did you have any? And
I just want to say, obviously, the Care for Kids changes totally family child care providers. That's the biggest change. Is the Care for Kids is really going to affect family child care providers, group child care homes, and centers. And I know Meryl's going to talk about the funding piece, the budget. There are also big pieces in the budget that will impact family child care providers in a positive way.
Got it. There's a new question that just came in. With the ratios changing, what does this mean for the size of the group for 2-year-olds?
It's a 1-to-5 ratio with total of 10 kids in the classroom. Is that right?
Yes.
Okay, great. Thank you. All right, Meryl, was there any other questions for Maggie that you had before we move on to the next segment?
I guess in response to the question about family child care, most of that had to do with centers and state-funded centers. The Care for Kids issues are the primary changes. That the change from the old regulations to the new policies and procedures that will happen as soon as OEC can put those together provides a little bit more flexibility to families in getting on to Care for Kids, and just makes it, there will be some changes that will have some impact on family child care providers, but it's all basically related to Care for Kids because there are very few family child care who are currently getting CDC contracts. There are some, but not a lot.
You're right.
And eventually, once you have early start up and running and you're doing RFPs to distribute slots that aren't being used, or, we cross our fingers, we get some more money for early start and we could expand the program, family child care providers should be included in those RFPs.
Got it. And yeah, Maggie, there was a clarification that was a question about the change in square footage requirements.
That I cannot answer. So we will get back to you on that.
Okay. And can you maintain 3 teachers and have 12 toddlers?
Oh, yes. I mean, 3 teachers and 12 toddlers. I'm not sure.
Yeah, that should work, right?
Well, it's a licensing question. I think we should get a licensing person.
Yeah, I would like to have our licensing director to handle licensing.
Understood. Yep.
And it's more specific on space. 3 teachers, 12 toddlers. It depends on the breakdown too.
Yeah.
Right. When does the ratio change go into effect? I know you mentioned it early on, but can you remind us?
We anticipate that we will have policies and procedures in place by the end of August. That is not a promise, but that was what we anticipate.
Understood. And is preschool now capped at 15, or can you still do 18 with 2 teachers?
You can do 18.
Yeah. Okay. Let's see. Okay. All right. So thank you so much, Maggie. I think that's it for now. And we appreciate that breakdown. The PowerPoint that you shared will be both in English and in Spanish, and will be put into the notes of the recording of this, which we post to YouTube. sometime, usually by the end of the day. And I will put the link to that YouTube in the chat in a minute. But it's YouTube, / Early Care Connection.
Thank you, Izzy. And I do want to note that the PowerPoint, I included where for each bullet, what section it pertains to in the bill. So people who are state-funded programs who are interested, it'll be easier to find in the bill.
Okay, that's terrific. Thank you. And I'm posting the YouTube link right here now for folks for later. Thank you so much, Maggie. We appreciate all that you have done this session and all you do to keep us informed.
Thank you and have a great day.
You as well. Okay, let me actually just take a second here. We are a few minutes away from Representative Farrar joining us to speak about 5002. So I'm going to ask Meryl and Ava just to join for a second. Is there anything that you wanted to go over before we switch over into, let's say, paid leave or some of those other things?
I can just do my little segment now before we have Kate, because Maggie referred to it in her presentation, because OEC is all encompassing, of course. It's important for providers to know that this session we got $18.8 million in Care for Kids. Now, some of you might be jumping for joy because you're very eager to get rid of the wait list, right? I just want to set realistic expectations. And of course, Maggie, jump on in whenever you'd like. More money into the Care for Kids system is always a great thing. And definitely the wait list, the last wait list number that OEC gave us was 1,554 on the wait list, with a wait list of 7 weeks from the United Way Care for Kids monitoring system. But it doesn't necessarily mean that that money automatically is going to give opportunities for an abundance of new people coming into the system. So just remember that it's a balance between who's in the system waiting on the list, and then if you're changing the qualifications of SMI, then that means theoretically there could be more people waiting. So yes, the new money should allow for a
Okay, so Ava froze there. Let me try and pick up from where she froze. The new regulations allow the commissioner to be able to set the income eligibility much more easily than in the past, where it had to be passed by the legislature. So if there's money available, my understanding is that the commissioner could raise eligibility. But the legislature's appropriations committee, when they were looking at how much money to, now you're muted, Ava, if you wanted to.
Horrible moment to freeze with such important information. It's like a cliffhanger. Where did you leave off, Meryl, when you saved me there?
Okay, Maggie's now raising her hand, so maybe she's going to clarify what I was starting to say.
I just missed 30 seconds here.
I do want to clarify one thing. It's in the original bill, there was a proposal, governor's bill, there was a proposal to raise the income eligibility from 60 to 65% of SMI, but that was not included in the bill. So it is still in statute. That right now it's at 60%. I just wanted to anticipate that.
And that's helpful. Yeah. So providers, again, it's a reminder, we have to be realistic and set expectations here, because as much as we would love elected officials in the state to keep allowing for more families to qualify for Care for Kids, if there's not enough money in the system, the Care for Kids system, then that means that more of a wait time would happen because more people qualify. So if in fact it stays at 60% of SMI, then the 18.8 coming into Care for Kids would start taking care of people who currently qualify, and make sure that that wait time is a little more efficient. If, in the future, and since it's in statute, like Maggie mentioned, if it does go into 65 of state medium income, or subsequent legislative years, it becomes a higher amount and there's not enough money to pay for it, then in theory, there could be wait times once more.
All right, great. Ava, is that what you wanted to cover this morning?
I do. I can nerd out some more if people want to, but we have a lot of presenters, so we could revisit the Care for Kids maybe in the end.
Okay, sounds good. And Meryl, did you have anything that you wanted to add to that?
Just that it's 150% of what the governor asked for. The governor asked for 12.9 and the legislature gave us 18.8.
All right, that's great. Okay, thank you so much. We are actually still, I know that at 10, we've got Representative Farrar joining us. So we'll, let's see, let's.
Want to move Coralise up?
I think Janae is going to go next, actually. So Janae, I think we'll jump into this section. We're going to invite Janae Woods-Weber from She Leads Justice in to go over her bill. And sorry for the confusion, everyone. Working with our legislators is always a little tricky for when they can join because they are doing 55 things at once, as we saw from Representative Cook. So we're just going to move that around a little bit. So I'd love to invite Janae Woods-Weber in from She Leads Justice to talk about paid leave bill that they worked on this session. Janae, please welcome, and you're welcome to join now.
Good morning. Thank you so much for having me.
And do you want to share your PowerPoint or do you want us to do that for you?
It would be great if you could share it.
Okay, great. Meryl, is that possible for you to do? If not, I can. Yep, I emailed it to you. And Janae, you can go ahead and do your introduction while we figure it out.
Great, thank you, folks. So my name is Janae Woods-Weber. I am the Executive Director of She Leads Justice. You may know us by our old name, Connecticut Women's Education and Legal Fund. We changed our name last year in celebration of our 50th anniversary. Using a justice and equity lens, we advocate for women and girls in Connecticut. And we had the honor of leading the Paid Sick Days Coalition for the last several years. And we were deeply pleased that this year we got our bill over the finish line. So while we are getting our slides up, yeah, we can move right to slide number 3, where it says paid sick days for all workers. Fantastic. So this year, House Bill 5005, an act expanding paid sick days in the state, passed the House and the Senate, and we are waiting for the governor to sign it into law. This bill extends access to paid sick days to almost all workers in the state. This is a great victory for workers. Connecticut was actually the first state to have a paid sick days law on the books back in 2011. But over the last 13 years or so, our law has become outdated. So we have been overdue in updating our law to be more modern and to be more inclusive. And so we were advocating to make sure that all workers were covered, to make sure that the reasons for which you can use paid sick time were more expansive, and to make sure that the coverage was more expansive. So can we move to the next slide, please? So under the new law, this will cover more workers. Paid sick time is now extended to almost all private sector employees over a 3-year phase-in. Under the old law, the law only applied to employers that had 50 or more workers, and specifically service workers. Now, you will have access to paid sick time, no matter the size of your employer, no matter what kind of industry you work in. And this will happen over the course of 3 years. So beginning next year in 2025, employers who have 25 or more employees will be required to offer paid sick time. The year after that, employers who have 11 or more employees will be required to offer paid sick time. And then the year after that, employers who have 1 or more employee will offer paid sick time. You will also have the opportunity to earn paid sick time faster. Under the previous law, people could earn 1 hour for every 40 hours worked. Now you can earn 1 hour for every 30 hours worked, and you can earn a maximum of 40 hours of paid sick time per year. So if you work a traditional 8-hour workday, that's 5 days, that's 1 work week. And you will also be able to access your accrued paid sick time sooner. You can access your paid sick time beginning 120 calendar days after your first date of employment. This was a really great win, in particular for part-time workers, because under the old law, there was an hours requirement. You had to work 680 hours before you could begin to access any accrued paid sick time. This was really difficult for part-time workers to reach that standard. Imagine you only work 10 hours or 20 hours a week. Reaching 680 hours can take a really, really long time. So by switching to 120 calendar days, we allow workers, no matter how many hours they work per week, to be able to reach that threshold, to be able to access the time that they've earned. Next slide, please. And another really fantastic feature of this law is that it has a more modern, expansive, and inclusive definition of family. You get to decide who counts as your family. Under the old law, you were allowed to use paid sick time to take care of yourself, to take care of your spouse, or to take care of your child. Under the new law, you will be allowed to take care of yourself or to take care of a loved one. And you get to choose who your loved one is. It doesn't necessarily need to be somebody who is related to you by blood or related to you by marriage. It can be somebody who is your chosen family. This is really important because we know that not everybody has the quote unquote traditional family structure. This also brings this definition in line with the definition that is in the paid family medical leave statute. This is one of the ways in which Connecticut has taken a step forward in being a more equitable and inclusive state. So we were very, very proud that we adopted this definition of family into this statute. Next slide, please. And how can you use your paid sick time? You can use your time off to take care of yourself or your loved one if you have a short-term illness like a cold, the flu, maybe you need to go to the doctor, maybe you need to go to the dentist, something like that, a short-term time off of work to take care of yourself, either preventative care or for the kind of sickness, you know, in a few days, you'll get better. Or perhaps you need to take a mental health day to take care of your mental well-being. You can also use a paid sick day if you have a public health emergency. This is important because we all just experienced the pandemic and we saw what happened when people were not able to take paid time off of work. Many people still had to go to work because they were forced to make an impossible decision between losing a paycheck or being able to stay home. And unfortunately, too many people could not afford to miss that paycheck. And so they had to go to work. And we saw the consequences of that. And you can also use paid sick time if you have quarantine. As we saw during the pandemic, if you got COVID, you had to take a few days off of quarantine. And unfortunately, COVID is not one of the covered reasons usually to take paid family and medical leave, which is a separate program, which is for long-term illness. So when you have your positive COVID test and you need to quarantine for 5 days, that is where paid sick days come into play. If you are not ill enough to be admitted to the hospital, for example, you would not qualify for paid family and medical leave, which is a separate program. Ava, I see a hand.
Wait till you were done. I'll wait. I'm sorry, Janae. I would have held off.
That's okay. Thank you. So that's actually the end of the presentation. We really invite you to connect with us. This was a simple presentation. We know that everyone has different circumstances relating to the size of your business, relating to whether you're a part-time employee, whether you're a full-time employee. We do invite you to be in touch with us, to be in touch with our policy team. Please get in touch with us. We'd love to speak with you.
So I'm gonna start the questions because I see there's just a couple of questions in our Q&A already. So a lot of the people watching our audience are a mix of employees and also employers, people who are either owner operators or they could be directors managing, right? So my curiosity is, if any part of the bill has portions of Connecticut that's exempt, that just don't qualify, or as an employer don't have to participate. And I'll take my hand down.
Well, if you are self-employed, you don't need to participate. And there are certain situations where if you're covered by a union, you are not covered by this bill.
Ava, did you have more that you wanted to add? No, okay. All right. All right, Janae, thank you so much. Is there more that you want to go over before we wrap up this segment?
There was a question in the Q&A about it. Someone had a question about, was it answered already?
It was answered, yeah. The question was, does the new sick time regulation only apply to full-time employees? And the answer is that it applies to all employees phased in over 3 years. Janae, is that correct?
Yes. Yes.
Yes. All right.
And I know that sometimes after people see these presentations, a question comes to you. Please feel very welcome to email me. I'm happy to answer any questions that you might have. And we're also happy to come and talk with your workplace about this law as well, if that's helpful to you.
Thank you so much, Janae. I did put your social media handle and also website in the chat, but if you want to add an email for folks to get in touch, you can do that as well. And thank you for your work and advocacy this session.
Thank you.
All right, we are going to turn to Representative Kate Farrar, who is a terrific champion of early childhood issues and really took the lead on the passage of Bill 5002 this session. And so wanted to invite her and also thank her for her work. But Representative Kate Farrar, thank you for joining us. And thank you for all of your work this session. I'd love to introduce you and welcome you to speak on that bill.
Thank you, Izzy. Thank you, everyone. It's great to be here with all of you. I know that many of us on the legislative side, we are still coming out of the fog, which is the end of legislative session, but I couldn't be more thrilled to be with all of you because you are the ones who are putting your heart and your soul and your hard work into the tiniest important people in our state. And I have to say, it has just been a true pleasure to not only get to work on this bill that I'll chat briefly about, which was the House Priority Bill 5002, but also I know we are so united in this bill and so much of what happened this session continuing to be a step towards the investment that's truly needed in the work that you do. So I am just going to cover, I think, 3 main components of House Bill 5002. And I just want to say from the start that this House Priority Bill really became a priority bill because of the crisis that you all are facing, because of so many of you using your voice and making clear that we need to do better for our families. We need to do better for our workers. We need to do better for our economy. And that's why this bill was a priority bill of 5002 and became such a bipartisan effort in the House and the Senate. And from the start in working on this bill, it was wonderful to work with so many folks who are on this conversation today. It couldn't have been possible without their expertise and input every step of the way. And there are 3 key pieces that I think really speak to, again, the short-term and the long-term efforts that we want to make towards investing in the early childhood sector. And the first is what we really tried to focus on, which is the further development of this new early childhood care and education fund. Learning from several other states around the country, here in Connecticut, we have wanted to be abundantly clear that early childhood care and education should have dedicated funding year after year. And that's why we pursued further developing this fund in this legislation, including having a commission that is guided by the expertise of many of you as providers and parents and folks who are in the field every day, that we hope is a continuation of some of the great work that the Blue Ribbon panel did, but really charts the future of how this fund can be used to, as I shared, fund year after year what's needed for early childhood care and education. So a big part of the bill was further establishing this fund structure with the comptroller and treasurer treasurer being able to invest these dollars. Also for this fund to be able to not just accept public dollars, but also private dollars, because we know that there are philanthropic and business partners that also want to contribute to the future of early childhood investment in this state. So we really see this as a next step for how we can fund this incredible and much needed work in the future. The second big component of the bill was to establish what is a new pilot program, which is often referred to as TriShare, learning from what Michigan and North Carolina have done to establish this shared funding model for how to pay for childcare, a share paid for by business, a share paid for by the employee, and a share paid for by the state. This pilot program, as set up in the legislation, is for 2 years and is for New London County employers, although any employee can live elsewhere, but their employer would be in New London County, which is identified as one of the key childcare deserts in our state. And this 2-year pilot, again, will really give us further information for us as a legislature and for us based on all of your input as well, to know if this is a further direction we'd like to go in really trying to solve some of these needs of childcare. And then finally, because of our budget situation of, this may have been discussed already, of us not opening the budget this year, we wanted to pursue what we could for funding. You likely already heard that there is funding that we further secured for Care for Kids, but we wanted to see what we could do to further support so many of you who are in the workforce every day doing this work. And that's why we were able to establish in this legislation, a wage supplement program, which will be for state-funded programs, both childcare and school readiness, for those nearly 4,200 workers, both teachers and assistant teachers, to get an at least $1,800 wage supplement. We, again, wanted to do everything we could in this bill to acknowledge this short-term need, to acknowledge so much of the work that you're doing every day, with setting up, as I shared, this fund for the future so that we can make these much needed further investments down the line as well in our budgeting. But we do hope that this wage supplement acknowledges how essential it is to really value the work that you all are doing every day. And this wage supplement will be administered by the Office of Early Childhood, very similar to some of the work they've done in the last few years. And we knew that this was a way to use what funds we could based on the budget decisions this year to make sure that so many of the workers were acknowledged for their incredible work. So again, those are the 3 key components of 5002. There were a number of other pieces that were brought into the bill from other bills that came out of education. But again, the real thrust was having this bipartisan effort so we could further establish this fund structure. Secondly, to establish this unique and innovative TriShare approach, which we hope will demonstrate great results for an employer and employee partnership. And then finally, really doing what we could to show workers how much we acknowledge their work and so many of you being undervalued for that work with that wage supplement. I do want to share that because of everything you did and because of this partnership from all of us together, that this bill passed unanimously in the House and the Senate. And we are anxiously awaiting, like many folks who passed bills, for the governor to sign this bill. And I have no doubt that we will hear some good news on that, as well as some of the other bills that you've heard about that were focused on so many of our early childhood providers and parents. Thank you for giving me this chance to share a little bit of these highlights. And I will leave it to Izzy if there's any questions that I can answer in the moment.
All right, thank you so much. Meryl, I'm going to actually open it up to you. Is there anything that you want clarified on that before we move on? And you're muted. Meryl, you have to unmute. Oh, he can't hear me.
Right.
There we go.
Okay. So initially, this bill included money, and you want to just talk a little bit about that?
Happy to. So the bill, as the bill came out of the Finance Committee, had, to be clear, there were several budgetary items to the bill. So there was a budgetary item for funding the fund, we'd like to say. There was a budgetary item for TriShare and launching that pilot, and then also a budgetary item for the wage supplement. And what I would say is that given kind of where we were headed with the budget and not opening up the budget, both of the funding mechanisms for the fund found it was more difficult to pursue that this year. So originally in the finance bill, we had $50 million from the operating surplus of the coming year. And we also had $50 million in bonding to be put in the fund. And both of those do not exist in the final version. But we do have in the final version of the bill the money for TriShare, certainly, and the money for the wage supplement. And I think one of the pieces of feedback that we heard in the discussions about the $50 million in operating surplus and the $50 million in bonding was interest in having this commission actually come together and start to determine what these funds would be used for. And that would provide greater clarity for what kind of the key purpose of that fund would be used for, and that would help in kind of our further efforts around funding the fund. But what I would say generally is that because the budget was not opened, it made it more difficult to pursue, especially the operating surplus dollars.
So do you anticipate next session another push then to get some funds put into that fund? Some money put into that fund, excuse me?
Yes, thank you for priming that. Yes, I think all of our efforts are taking these steps that we have now further established this structure. We can further establish this commission and start the work of what we would pursue to have the fund do with the funds. And that will allow us leading into the next session to make a significant push of how we will sustainably consider funding this fund in the future. What I would say is one of the things we looked at going into this session, but knew it would take more work and would take us having the full 2-year budget cycle to look at are some of the approaches that other states have taken in dedicating certain revenues into the Early Childhood Care and Education Fund. So that this will provide us an opportunity to kind of build up the ability to make those recommendations and to have a chance to be ready as we come into session in January.
All right, and the wage supplement, I believe, was maybe that was a little bit more Representative Cook's purview, but that one is pretty limited to the state funded centers, right? I'm seeing some folks saying, like, what about home-based providers? What about administrators? What about? I mean, we know how much the entire industry is struggling. So maybe you could just address, that it's limited and maybe why, if that's possible.
Yeah, I'd be happy to. So, and I would say, one of the reasons why, unfortunately, this is limited to $9 million is because, again, from a standpoint of us not kind of opening up the budget in full, we were kind of constrained to how we could transfer certain dollars appropriately. And the $9 million is identified in a lapsed line item from the Office of Early Childhood. And that line item is for our state-funded programs, for our early childhood and school readiness programs. And so in many ways, we were limited to using those dollars, for a wage supplement within those programs. Although, as you said, Izzy, although we want to and know we need to do so much more, we wanted to do what we could with that $9 million lapse. And that's really why it evolved to, unfortunately, just being focused on the workers in those centers. But I can tell you, I think everyone who has been engaged with this knows this is absolutely not a fix. And it does not fix, again, these sustainable funding issues that we need to address, hopefully, as we move forward with the fund structure.
Right. And just to remind everyone, Connecticut has a 2-year budget cycle. This is the second year. And so there was, the budget was not opened up for discussion. It's sort of created in year 1. And then that also affects year 2, and then they rethink it. So next year is the big budget year where bigger changes are made. And this year it was not reopened. And so I just want to remind people about that. Representative Farrar, was there more that you wanted to go over before we wrap up this segment?
No, just thank you to everyone. And as you said, Izzy and Meryl added, this work continues. So I know we are going to be working together through the summer and the fall to make sure that we are well prepared as we come to next session and the next budget together.
Yes, that's right. And what do you recommend, folks? I mean, you're a representative. What do you recommend for folks here who want to see something different happen in the next session? What should happen in the next 6 months from our side?
I think one of the things that was so pivotal, this year to raise the alarm was really, how this is affecting, parents and not being able to work or having to, leave jobs and those stories. And I think from so many of you that are in the workforce, just sharing how difficult it is for yourself to make ends meet, or for your fellow employees to make ends meet. Those stories really go a long way. And the more that you can, individually connect with legislators that are your state reps or state senators, really makes a difference. And you could tell in having such bipartisan support that we are on the right track for making sure that everyone sees this as an issue that can't be ignored. And I think, although it can feel, really challenging to feel like, why don't people just get it? Why can't we just solve this problem yesterday? I can tell you that I do feel like the momentum is there, and it speaks to it in a way when we were having the press conference the day of 5002. The Speaker of the House, did acknowledge that the amount of funding that he wanted and we wanted was not there in the budget this year, and he committed that this would be another top priority for next year as we come into the budget cycle. So I think that is good news, but as you said, Izzy, making sure people just continue to share that this is a challenge and a story that they're facing in their own family can really help us as we move into the summer and the fall.
Great. Yeah, thank you. And so remember, everybody, the fall is a great time to invite your legislators to your center, to your home base, if you're a home-based provider, to invite them to have a roundtable with early childhood people in your community. So think about who you could have there, and prep, give them a break, give them a little bit of time. But then the fall is the right time to start to have those conversations and prep for January, which is a big session. So Representative Kate Farrar, thank you so much for all of your work and for all you do for this community.
Thank you all. Yes, I look forward to all we're going to do together.
All right, fantastic. Thank you so much. All right, now we are, real quick, before we move on to the next segment, Ava or Meryl, did you have anything that you needed to go over before we switch into kindergarten with Coralise? You're all good? Okay. So Coralie Santana,
I think that Ava was saying she needed to say something.
Oh, she did. I'm sorry. My apologies. Ava, you're muted. Go ahead.
Thank you, Izzy.
Thank you so much.
Thank you, Meryl. Thank you, Ava. Thank you, Coralie. Thank you, Ava. Thank you, Meryl. Thank you, Ava. Thank you, Coralie. Thank you, Ava. Thank you, Meryl. Thank you, Ava. Thank you, Coralie. Thank you, Ava. Thank you, Meryl. Thank you, Ava. Thank you, Coralie. Thank you, Ava. Thank you, Meryl. Thank you, Ava. Thank you, Coralie. Thank you, Ava. Thank you, Meryl. Thank you, Ava. Thank you, Coralie. Thank you, Ava. Thank you, Meryl. Thank you, Ava. Thank you, Coralie. Thank you, Ava. Thank you, Meryl. Thank you, Ava. Thank you, Coralie. Thank
can't. Yep. Nope. You're muted again. Come. It's not working. Okay. We'll call on you in a few minutes. Hold on. Here we go. Sorry, folks, for the technical difficulties today. We'll give it one more second and see if we can get her on. And we've got, she's going to change her feed. Okay, no problem. Okay. Coralie Santana, I'm going to invite you in from the Connecticut Project to talk about a few different bill, kindergarten start age change and incubator. Coralie's welcome. Thank you so much for your work and for being here with us this morning.
Thank you so much for having me. I am very grateful to be here today. My name is Coralie Santana. I'm the Policy and Advocacy Strategist with the Connecticut Project Action Fund. If you remember, if you were on those calls a few months ago before session began, I was before you asking for your help and support regarding the kindergarten start age. I am disappointed to report that we didn't get what we asked for in that advocacy, which was a one-year pause on implementation of this policy while families could figure out what they were going to do to access care. Along with $50 million for school readiness programs, as well as Care for Kids, for families to be able to afford the cost of care that additional year that they would be required to do or to cost for their families. It was a very difficult session. I mean, you've heard that a lot from, I think, every speaker that we had this morning, and it is true. I do want to point out that you all, along with the parents, did a great job advocating for what is necessary in the early care and education system, and we are really grateful for that because, you know, all our work is not possible without you. We had over 5,000 families reach out to their legislator on this issue alone. Access to care, uniformity in the implementation of this law, and, you know, support for families who just found themselves not knowing what to do as they're learning about it. We want to thank Representative Corey Paris, who championed this issue. He has been a fierce advocate for the early care sector, having worked in that industry himself. And he, you know, did his best to ensure that members of the General Assembly knew that this was a problem for families as it stands. Now that session is over and the legislature did not decide to take action on this, families have to access care or seek a waiver process if their child is ready for kindergarten. And that is complicated. It isn't really straightforward. And there are certain rights that parents have alongside this waiver process. And so the Connecticut Project has developed a guide, if you will, to navigate this change for families in seeking a waiver process or simply trying to find care where it exists. Every community is a little bit different in terms of how this waiver is being conducted, but every school district has to do the assessment, right? If the parent requests an assessment, they have to do it. It isn't permissive at the way the law is written. And so for that, I will put some link in the chat, or you see the chat is available. Those guides are available in English and Spanish within the same document. If you have requests for another language that is spoken in your community, we can certainly commission that to be translated and get it to your hands. So please reach out to us in that endeavor. And then Ava spoke a little bit about the $18.8 million that was secured for Care for Kids. I think that will be, in terms of this issue, what will help families who may be having to access childcare for one more year for their 4.5-year-old, or their 3.5-year-old, or their 2.5-year-old who is not yet 3, to access pre-K, because we know that that was another issue that kind of wasn't anticipated, was that a lot of your programs didn't have the room to keep the 4.5-year-olds and open up new seats for the 2.5-year-olds. And so it's just been very hard to accommodate. I'm sure that you're getting parents asking you questions, and as we get closer to the school year, I can anticipate those questions will grow. And then the second part, the childcare business incubators, we advocated for an expansion of this program that started in New Britain at the YWCA, and they are having their ribbon cutting, I believe, next week, which is great. This expansion allows a family child care provider to open up a child care facility outside of their home, right? With the same license, just in a different setting that is backed by an organization that has, met the requirements stipulated by OEC to be able to open. And so previously, there were only 7 communities who could access this pilot program. That is no longer the case. Any community within the state of Connecticut can access this program. You just need a nonprofit organization to kind of back you, or a business entity. I guess there's nothing preventing that. And we, as the Connecticut Project, are providing support for that. And so if you want to learn more about the incubator program, I would encourage you to reach out to my colleague, Courtney Parkerson. I have just been informed that next month, a implementation toolkit will be released on our website for family or for providers or prospective providers to learn more about the program, and for nonprofit entities to learn how to bring this program to their local community. So with that being said, if you all have any questions, I'm going to put all the links right back in the chat one last time. And if there are any additional questions, please feel free to contact me directly. As it relates to policy and advocacy, I also speak Spanish. So if you are that most comfortable in that language, I will be happy to speak to you in Spanish. And if we need to get an interpreter for any other language, I'm happy to get that done somehow. So thank you so much for your time.
Great, Coralise, there's a few questions for you. First, I did share the guide, the link to the guide in English and Spanish in there, so you don't have to do that if you don't want. It would be terrific, though, if you could share your email address so folks can get in touch with you. But there's a few questions here. First, I did get a couple of things saying that this is great and thank you for the guide, very helpful. Someone says they saw that the guide was released. If a community already has held multiple kindergarten screening sessions, are they still required to offer evaluations if a parent makes a request after their final screening date, like over the summer?
Yes, because let's say you just moved into that community, right? Like you come from out of state or wherever the case may be, and this is a law, you have to comply with it. The entity, the school would have to find a way to do this waiver assessment. And you can contact, your local superintendent's office, as well as Board of Education, and you can escalate that all the way to the Department of Education to make sure that your child and your rights are not being dismissed.
Okay, and so
simply not being misinformed.
Sure.
Because the law doesn't say that the waiver has to be done by a certain date.
Sure. And if so also that would tell districts that they might want to have another screening session closer to the start of the school year, not finish them all up, in June.
It could be possible that the districts also have no room, and so that is an issue that when we advocated on this, we worked with the CABE, which is the Association of Boards of Education, as well as the Association of Superintendents, and they're doing everything they can to accommodate the children who are ready to enter kindergarten. But the reality is that some of them don't have additional space to take those children in.
Sure.
So there are, which is why we were asking for more time, right? There are details that needed to be ironed out. And so folks are just trying to do the best that they can to navigate this. And we are simply putting this out there as a resource for parents who have to navigate this reality.
No, it's very helpful to have a non-governmental helper in this, I think, for a lot of families, because it can be a little bit daunting and terrifying. Let me actually call on Representative Robin Comey, who also a terrific fan of, terrific champion of early childhood, and somebody who's been a great partner over the years. Representative Comey, I saw you had your hand raised. Please, you're welcome to join us.
I did. Thank you so much, Izzy. And I've been on 2 simultaneous meetings, but I appreciate, been trying to keep informed on both of them. But I was wondering, Corliss, if I've just heard data from, well, I've heard from my district, from my preschools, that, of all, just, are we keeping track of the district's data into who is being declined or denied entrance into the kindergarten, and specific data around like where the child is may or may not be currently attended preschool, or any of thank you, Diane, or any of the information that, are we collecting any data on this?
The Connecticut Project isn't collecting data, but I would assume that, and this is, a fair assumption to make, if a parent is reaching out to school districts, they're probably keeping track. I don't think there is a statewide kind of mandate for that data to be centralized anywhere, unfortunately. Anecdotally, we've had parents that have reached out to us for support who've said, like, they went through an assessment, their child was denied, and unfortunately, the only resource that they were offered was a waitlist spot at their preschool, which was just unfortunate for that family. And so in this anecdotal case that I'm referring to, that family actually moved towns and got their child assessed in a different school district. And this is to the lack of uniformity, right? And got admitted and said that their child, that school district said their child was ready and is entering kindergarten. So I think every family obviously knows their child best and will do what they need to for a child. But as far as like a standardized way to collect this data, I don't believe that there is.
I can correlate with CSDE and see what kind of information they are prepared to, collect and share, and if that's helpful.
Yeah, that would be extremely helpful. And I know that there are other entities who are interested in that, specifically for programs for children who are trying to access special education, pre-K and kindergarten, because that's going to be another big issue. And folks might feel that they are being discriminated against. And so I think folks need to prepare for that. And we are happy to support all of the families just trying to do what's best for their kiddos.
Yeah. All right. Thank you so much. Representative Comey, did you have more to add to that, or are you all set? I think she's all set. Okay. And I know she's in another Zoom.
I'll report back. I'm sorry. Yeah. Thanks.
No problem. All right. Thank you so much. Okay, Corliss, we have another question. Will the waiver still occur next year? It's a big staff commitment for some districts. Just curious. I think this is a one-year thing, right?
No, as the law stands, they have to do the waivers every year. It's not a one-time waiver. The superintendents had liked it to be a one-time thing.
Okay, I did not realize that.
The law was not opened up to have any of these discussions, right? The committee didn't open it to have a public hearing, and so none of these concerns were really heard publicly outside of the narratives that were created in the media.
Got it. Okay, that's good to know. I had not understood it that way, so that's great. The smaller districts are taking everyone who applies for a waiver. In our city, this is a question from a member here. In our city, none of the late birthday SPED children received a waiver. About 50% of the children who applied did get in, but more girls than boys. This upcoming year in preschool will be tough. So are you seeing that a lot across the state, where the waivers are either being applied to specific groups, applied unevenly? What do you think the impact on that will be for our providers here, who are some kids, maybe in particular groups, SPED kids in this case, might be not granted the waiver, will be in preschool an additional year? how are you seeing, or excuse me, not grant, I'm confusing myself, but how are you seeing that across the state?
Yeah, I think, again, different across the state, you know, whether or not there are open preschool programs, right? There are only certain communities who have a shortage of preschool seats. And some kids are being turned away. Some families may decide to keep their kids at home that additional year. And that's not to say like those kids might be ready when they turn 5. If they're not accessing any preschool program, it's very concerning. Yeah. I think what providers should do is point the families to this resource. And this resource, you know, obviously points a lot of different ways depending on the circumstance. But the application of the waiver process will certainly give us more to talk about in future sessions, because we won't know how this impacts people completely until it starts happening and you start seeing those patterns. Whether or not they're boy or girl, or, you know, later in the September to December cutoff, is not data that we have yet available.
Okay. All right. Thank you so much, Coralise. And we will get back to you when, you know, maybe at a later date when we want to review this again and see how things are going. Thanks for your help, and thanks for your time and advocacy.
Thank you.
All right. Meryl and Ava, I'm going to call you guys back in. Meryl, I think that you are up next to speak about, well, actually, let me first say, any questions that weren't covered that you want to go over?
I've got 3 things that I wanted to talk about, but not related to questions there.
Great. Okay, perfect. We're going to move on from that topic. Okay. I know there's so much to talk about this morning. I want to make sure that we get it all in, but also get each thing covered appropriately. Meryl, you are going to talk about teacher certification. You've got a few other things, so go for it.
So one of the things that Representative Cook mentioned was the pushback from the field about a proposed change around teacher certification. There was a big move to streamline the teacher certification in Connecticut. And one of the things that they did was to change the certification for elementary school to include preschool through 6th grade. That gives superintendents a great deal of flexibility to put teachers in places that they were having trouble filling. But it raised real questions among the early childhood higher ed folks about whether or not early childhood was going to get diluted out of the elementary school. Instead of having its own certification of pre-K through 3rd grade, that now it becomes just one general elementary school certification. And just as anyone who's taught preschool, the thought of trying to teach 5th graders seems daunting. It should seem daunting for a 5th grade teacher to think about teaching 3-year-olds because it's a very different thing. And so there was real concern that we were going to lose the expertise of teaching early childhood in higher ed because it would become such a small portion of the K-6 certification. The pushback resulted in pushing back the implementation date of this by a year. But I think we should all be aware of the fact that the chair of the Education Committee in the House strongly believes that there ought to be more preschool in public schools. And that's something that we as a field need to think about. I think we all understand that if all your preschoolers went off to the public schools, it would be very hard to operate early childhood programs. So I'll come back to that in a minute. But one of the other things that I wanted to mention was Senate Bill 5 included a provision that will eventually make families who are eligible for Husky eligible for Care for Kids without the work requirement. To simply say that if you are eligible for Husky, you are eligible to get a Care for Kids certificate. It won't be an immediate thing because, first of all, they have to figure out how to get the Care for Kids computer system to talk to the Husky system. And then the next thing to understand is that this is the last category in the priority hierarchy, so that they first pull the working families, and then they pull the families who are in higher ed or job training program. And then they would get to folks who are Medicaid eligible. So I forgot the first priority. The first priority are the protected status group. Those are the children whose parents are coming off of TANF, the families who are homeless, the families who are the children who are in foster care or who've been adopted or in now sponsored guardianship. And so that group is the protected services category. They go first. Then the next group is working parents. And then the next group are parents in job training or higher ed. And then the last category is the families who would be who are eligible for Husky. So I don't expect that to happen anytime soon. It also means that you have to have more money to support more caseload. So that's all of that. Now, I mentioned earlier this whole issue of preschool in kindergarten. So I wanted to mention that the Early Childhood Alliance is going to be doing a summer advocacy academy. We're gonna have several different offerings there. Sort of an advocacy 101, advocacy for folks who've done a little bit so far, and then some study circles for folks who want to dive deep into an issue. One of those will probably be looking at public preschool and how that's been implemented in other places, and if it was coming here, what we would want to try and do to shape it. So I'm going to put a link into the chat. This is a survey about that Summer Advocacy Institute. We're trying to figure out sort of how to structure it and what the interest is. So if you wouldn't mind just taking a couple of minutes to do that survey, click the link and have the window open after the Zoom, you can fill it out. So I'll stick that in. I'll do it in English and in Spanish.
Okay. Was there more you wanted to go over, Meryl?
I think those were my 3 issues that I wanted to talk about.
Okay, so we have a bunch of questions here now that I know we still have some folks were able to stick around. I would love to invite Janae back then to go over some questions in here. Let me see, I have to pull them up. I think one of the questions, and I have to find it again, it was back a little while ago, but Janae, I think this was about how can folks plan to pay for the changes in paid sick days. So if you could just jump back in and maybe what have you guys been sharing? How have you been talking about this? And what are your recommendations for small employers who may not have been contemplating this or considering it in their budgets? And of course, everyone here is working on the margins.
Yes, that's a really great question. And one that we gave a lot of thought to, and the impact on small businesses was at the forefront of all of the conversations around paid sick days. And if you recall, I mentioned that there is a 3-year phase-in before we get to one employee being covered. So if you are one of the smaller businesses, you have some time to be able to sit down and think about how you will, factor this into your budgets for the year. As I mentioned, next year is when it goes to 25 employees, then the year after that to 11, and then the year after that to 1. So there is a little bit of time. We also have written into this bill, or I should say the legislature has written into this bill, a task force that will examine the possibility of tax credits for employers that have for small employers to address some of these concerns. And also one thing to remind folks is that the rate of accrual, even though you can earn sick days a little bit faster, it is 1 hour for every 30 hours worked compared to 1 hour for every 40 hours worked under the old law. The rate of accrual is still actually relatively slow. So for example, if you have an employee who works 40 hours a week, they would need to work 6 full weeks before they could accrue 1 full day off. So it isn't as if you would immediately need to begin providing full sick time to every single person. I mean, you could write your policy to be like that, but it is an accrual rate. So people are accruing at the rate of 1 hour for every 30 hours worked. So that also provides some relief to employers as well.
And Janae, if you're already providing policies that are comparable or better than what you just explained, you're good, right?
Yes, you are. So if you are providing PTO policies that already provide this amount of time and they can be used for sickness, then you're covered.
Yeah, great.
What this law does is it provides a minimum. You are certainly welcome to do more and to do better.
It's we've been running this call for now 4 years. Congratulations to all of us for sticking around. And you know, the push and pull has always been, we need to really fix this whole childcare system because employers want to do as well for their employees as they can here. I know that every provider here wants to give the moon to their teachers. And also, you know that they're not making enough to even afford to pay those teachers what they deserve when they're in the building. And so this has always been our push and pull here, is how do we both support providers where they are right now and try to push the industry to where it needs to be so they can support them in all of the ways that they wish. So, you know, in the questions, you can hear that tug. And so, you know, I don't know if that, I'm sure you're seeing that in other industries as well, but this is the one we focus on.
Yes, absolutely. And we have a lot of research that shows, you know, what you can expect, particularly as a small business and you begin offering paid sick time. For example, we hope that you'll find some comfort in knowing that this is not a policy that employees abuse. There's lots of data to show that there is very little to no abuse of this policy. And on average, employees, when they accrue their full paid sick time, they generally only take 2 days a year. And employees don't take more time than they need. And when you think about it, it makes sense because we all know people working in this industry tend to need to work because they need their paycheck. So people are coming to work because they must work. So people are not using paid sick time because they're simply trying to get time off of work. So that's also something to think about as well. And also, there is lots of data to show that when you don't offer paid sick time, there are costs incurred by businesses around illness related to productivity, related to employee loss when employees eventually need to perhaps leave employment because illnesses that progressed, if they had had some time off to get better, become worse, and then they are no longer able to be employed. There are costs associated with needing to hire, recruit, and train new employees. So if anybody would like to see any of that information, very happy to share some of the data that we have with you on that.
Great. And someone's requesting that you share the policy, you know, the sort of maybe the legislation or any information you have in the chat. Somebody just wants to know, is it clarification? Do you count the 30 hours in a week or is it every 30 hours worked?
Every 30 hours worked.
Okay. And then when does this, if you could just go over the timeline one more time, when does this go into effect for the first group you mentioned with 25 or more employees?
January 1st of next year.
Okay. And then it's 25. And then did you say 15?
11.
11. I'm sorry.
January.
15. Excuse me. 25, 11, 1.
Yes.
So over the next 3 years. So January. And for substitutes, you know, folks here, we obviously hire a lot of substitutes to cover in their program. If they cover enough hours in a year to qualify for sick time, if you're not a regular employee, someone who covers vacations for staff, works some weeks, is that a person who would be eligible for paid sick time?
If you're not an employee, you mean someone who's a contract employee?
Oh, it's not clear in here, but I think it's more like if you're just called in, you know, here and there, it's a little bit hard to say. If you don't have a regular schedule, it's hard to say what a day that you would call out for is, unless you're, okay, cover these 2 weeks. You know, would you get paid time off for if you're not a regular employee with a regular schedule?
Well, this bill has some exceptions for people who are considered seasonal employees, although the situation you're describing doesn't necessarily sound like someone who is a seasonal employee. But we can talk about that offline. So I think I would need some more information.
All right, sounds good. Yeah, we can cover that.
Just to be a little more specific here, there's a good handful of smaller childcare spaces that really depend on on-call workers. So let's say if someone is out and they have their core teachers in a classroom, they might have assistants that rotate between classrooms and someone, like their version of a sub pool. So it seems to me the way I took that question is, if this particular person is an employee, but doesn't necessarily have full-time employee hours, they're more of a part-time employee coming in and floating in, what happens if they accrue X amount of hours in the end of the year to emulate a full-time employee? Are they then, do they then have to do, full-time employee status? Like what happens?
If they are an employee on your payroll, then they're covered. It wouldn't matter if they are part-time or not. If they are an employee on your payroll, then they are covered.
All right.
Thank you.
Thank you so much. All right. And thank you again, Janae. We actually have one more question for Maggie before we've got 2 minutes until we end here. Maggie, I think you wanted to come back in and talk about the family child care ratio. Are you available to do that?
I didn't ask you to come back about the family child care ratio.
Oh,
no.
Okay. All right. Apologies. Meryl, I'm going to go to you for that then.
Yeah. So the question was whether or not you could have 9 children with 2 staff.
Oh, yes. Yes, that rule still, that provision still applies. So that was passed last year in legislation, an important piece for the family child care providers. That remains in effect.
Okay, great. In our last minute, Meryl or Ava, was there anything that you thought needed to be covered today?
I just want to do a shout out really fast to all of the amazing collaboration that we had from our partners, CT Voices, the Connecticut Project, All Our Kin, the Early Childhood Alliance, the Circle. I think it must be said, because at the Capitol, the different advocacy days that were had were not just one group. Child Care for Connecticut's Future is a multitude of groups, and all the wonderful people on this call were from, She Leads Justice and different organizations literally making this legislative session happen. And we only had a snippet of who was physically there presenting today, but there are so many other organizations that were physically there. There are childcare centers all across the state who went. We had over 130 individual parents and providers physically at the Capitol lobbying, which for us in our industry is very, it's amazing. And then Izzy, you can correct me, I think over 3,000 letters sent to legislators. So I just wanted to recognize that.
Yes, no, it's terrific. This was a unprecedented year in how much you all participated. And so, of course, all of these partners, but I mean, I'll just add in, and I think to echo Ava, this community really showed up this year. And this was a short session. This wasn't a year that we were going to get a lot done. So if we could do that in this short session, imagine what we will be able to accomplish next year. Get yourselves ready, keep going with those letters, keep collecting stories, make a list of all of the parents you talk to who have a compelling story, of all of the providers just keep it on your phone, keep it on the side of your desk, so that when we get back to, okay, we're in advocacy mode again, you're ready to go, exactly who we need to get involved. So Representative Comey saying we have momentum, thanks to you all. And I think that is true. You can feel it. So thank you so much to of course, all our legislative champions who are here today and those who were not. There's a terrific group of them. Thank you to all of you. And if you have more questions about the legislative session, feel free to contact us. There's so much more we probably could go over, and we want to know what you need to know about, as always. So feel free to email any of us. You can, you all know our emails at this point. You can also see the recording of this up on our YouTube channel in the next 24 hours. Typically by the end of the day, it will include all of the links. Thank you so much to Sandra for providing interpretation. And thank you to everyone for being here today. So have a wonderful week, and we'll see you next week.